with the American Red Cross.
Reporting from the State House, student here at Suffolk University.
Boston Neighborhood Network.
We're getting the biggest update.
Have nearly double the capacity.
MBTA official convenience store like this. I'm reporter Maria Valdes. Join me on the next edition of Suffolk News.
Hello and welcome to this edition of Suffolk U News, the weekly news program brought to you by the Department of Communication and Journalism at Suffolk University. I'm Alex Millian from East Haven, Connecticut.
And I'm Brittany Weiner from Peterborough, New Hampshire. We're happy to be coming to you on the Boston Neighborhood Network and, of course, on the internet. Boston is seen as a hospital and pharmaceutical company mecca in the United States. With more than 40 hospitals in the 617 area code alone, medical centers are seemingly everywhere.
Looking at cities of similar size to Boston, only Philadelphia has more hospitals than Metro Boston. Dallas, Seattle, Chicago, and Atlanta each have fewer.
But this is just how many hospitals. U.S. News & World Report ranks Boston hospitals top 3 for endocrinology, neurology, and orthopedics, just to name a few.
One of Boston's outstanding hospitals is also doing some cutting-edge work right now in the field of breast cancer. Researchers at Massachusetts General Hospital have created a 3D mammography that is helping to save lives. The device has been proven to work better than regular mammograms. This is because the image is now cut into many three-dimensional pictures, allowing doctors to see more of the breast than they were able to see before. Since June of this year, Brigham and Women's Hospital has performed 2 double hand transplants, one of which has been successful. Now, Massachusetts General Hospital is launching Boston's second hand transplant program. The new initiative will transplant a donor's hand as well as their bone marrow to trick the recipient's immune system into thinking that the hand is the recipient's own. Doctors are hoping this new method will help patients avoid the dangerous anti-rejection drugs normally used in a hand transplant operations.
10 Boston hospitals are launching a campaign to prohibit smoking on all hospital property. The campaign is partnered with the City of Boston in an effort to make hospitals and their campuses a healthier place for employees and patients. This new ban will make it so smoking is no longer allowed in any space outside the hospital, including parking lots, garages, and walkways. The hospital's plan is to be completely smoke-free by next April.
Two of the hospitals involved in the campaign are taking another approach to keeping its campuses healthy and requiring all patient access employees to get the flu shot. Beth Israel and Children's Hospital have decided that this is the healthiest and smartest decision for all employees and patients. One of the main reasons, a flu outbreak. Hospital officials say if a flu outbreak were to ever happen, they want their staff to be protected and able to help the sick. Parents across Massachusetts, however, do not feel the same about their children. An analysis by the Associated Press shows fewer Massachusetts children are being vaccinated for diseases such as the flu or chickenpox. The same is true for kids in 7 other states. And doctors say this could cause dangerous outbreaks if fewer parents continue to vaccinate their children.
Children's Hospital Boston and the pharmaceutical company Pfizer have teamed up to launch a new program. The program is aimed to identify potential drug therapies for the muscle-eating disease Duchenne muscular dystrophy, otherwise known as DMD. The 1-year research agreement will focus on the work of the Director of Genomics at Children's, Louis Kunkel, and his team. Kunkel was the founder of the dystrophin gene that shows the biology of DMD. He has had great success using a zebrafish model to test chemicals that may have restorative effects on muscle tissue.
My ultimate goal is to cure dystrophy and do it with some small molecule that is innocuous and could essentially prevent the outcome. The goal, though, of this particular collaborative agreement is to come up with a compound at the end of a year which works better than the ones I currently have.
Kunkel and his team began their collaboration with Pfizer on September 1st of this year.
The country's 3rd general hospital is now 200 years old. Massachusetts General Hospital opened its doors in 1811 with the completion of the Bullfinch building, which remains part of MGH's campus today. Since its opening, the hospital has not only helped and educated the people of Boston, but the people of the world as well. In 1846, Dr. William Morton demonstrated the effects and use of ether anesthesia at MGH, and a little more than 50 years later, the first X-ray exposures were taken at the hospital.
There's no question that medicine has many imperfections, but it has a rich and very valuable history, and this institution is a good example of that.
MGH continues to develop and change the world of medicine to this day. The hospital recently discovered a medication that reduces the risk of breast cancer. MGH is now sharing those 200 years of history and innovation in the form of a new museum.
Its latest building on the hospital's main campus.
A campus that stretches from Starwood Drive almost all the way to City Hall Plaza.
It's a two-story museum with a roof deck that welcomes hospital visitors to its present with a look into its past. For several months, the corner of North Grove and Cambridge Streets has been occupied by construction workers who are working hard to finish the new MGH museum before the end of the hospital's bicentennial year. The Paul S. Russell, MD Museum of Medical History and Innovation will house exhibits showing the evolution of medicine and practice at MGH.
We are describing an arc of innovation that's happened over 200 years, and so we use some of the old objects and compare them with current medical tools.
Senior surgeon Dr. Paul S. Russell was told the museum would be dedicated to him at a luncheon on July 8th of this year.
I was completely surprised. I really didn't expect it at all.
Although the museum is named after Dr. Russell, the museum honors everyone who has been a part of the Mass General community for the last 200 years.
That sense of Mass General being founded to care for people who had no other options is something that's very important to people who work here, and we are still translating what does that mean today.
The two-story museum will have permanent displays as well as rotating exhibits.
As I stand at the door of the hospital and see this avalanche of people coming in and out of here every day, and I wonder what's in their minds, what they think when they come into this hospital for the first time. They know that we're trying very hard to do things right, and they'd probably like to know more about that. And that's what the museum is going to help them do.
And the museum is going to help MGH do just that. Although the museum is not open to the public yet, the museum is scheduled to be completed by the end of this month. That does it for this special edition of Suffolk U News, the weekly news program brought to you by the Department of Communication and Journalism at Suffolk University. I'm Brittany Weiner.
And I'm Alex Mellion. Thank you for watching us here on the Boston Neighborhood Network or the internet.
Be sure to continue to watch for Suffolk U News Weekly beginning in February, bringing you more from the School of the Heart in the heart of the city.
Goodbye.